So I would normally be doing this bilaterally, but for the video I will not. So starting with palpations, I'm going to start at the fibular head, which is here, and go down to the fibular shaft, which is here, and then to the lateral malleolus. Also going to go back up here to the fibular head and do the common peroneal nerve, which goes down and branches out, and then branches out over here. We have two muscles right here. We have the peroneus longus muscle and the peroneus brevis muscle, and they both go down behind the lateral malleolus. The peroneus brevis attaches on the fifth metatarsal, and the peroneus longus goes behind the lateral malleolus and attaches to the first metatarsal back here. So also down here on the lateral side, we have the peroneal tubercle, which is just a little bump right here. And then we have the calcaneofibular ligament, which goes from the fibula to the calcaneus, so it's like right in here. And then we have the anterior talofibular ligament, which goes from the fibula to the talus, goes right in here. And then we have the posterior talofibular ligament, which is mirrored on the opposite side, so it's deep in here, from the fibula to the talus, back in there. So the posterior and anterior tibiofibular ligaments are here. They attach the tibia to the fibula, so they go across here. So we have the tibia here and the fibula here, and the ligaments go across and attach them here. So this is the anterior, and then posterior would be behind, attaching the two bones together. So now we have the tibial tuberosity, which is right here. It's this little bump on the top of the tibia. And then Gerdy's tubercle, which is here where the IT band attaches. It's a little divot right in there. And then we have the tibial shaft, which is your shin bone, which is this one right here. And then we have extensor hallucis longus muscle. So that muscle is here and goes across, and you can see the tendon of it right in here. It extends the big toe. And then we have the extensor digitorum longus. The tendons of them extend your toes, which you can't see them very well, but here's one of them. But they go and attach to all of the digits here. And then we have the dome of the talus, which is right here. You can feel it right in between the two malleoli. It's right in there. And then we have the sinus tarsi, which is this little depression right here by the lateral malleolus. And then, so like I said, we have the medial malleolus on this side. And then we have three ligaments right here called the deltoid ligaments that attach here and go down. So the deltoid ligaments are in this area. And then we have the sustentaculum tali, which is this little bone protrusion right here. And then we have the tibialis posterior muscle, which is just behind the tibia and comes behind the lateral malleolus and attaches here. And then we have the flexor muscles of the toes. So we have the flexor digitorum and flexor hallucis muscles, and they both come behind here, and the flexor digitorum comes and attaches to all the toes except for the big toe. And the extensor hallucis comes behind and attaches to the big toe. Now we have the posterior structures. So we have, I'll put her leg in like this, the gastrocnemius muscle, which is here, and then it also goes into the soleus. So the soleus is here and the gastroc. And then both of those muscles go in to combine the Achilles tendon, which attaches at the calcaneus. And then we have the subcutaneous calcaneal bursa, which is here, and then the subtendinous bursa, which is on the other side of the Achilles, which is more in here. And then we have the calcaneus, which is the heel bone. So now we are going into active and passive range of motion. So I'm going to have you bring your foot towards you. This would be dorsiflexion, and I'm going to have you press down like you're stepping on the gas pedal, and that is plantar flexion. Right now I'm doing active range of motion, so now I'm going to hold your leg here and point your toes in to demonstrate inversion, and point your toes out to demonstrate eversion. Good. So now I'm going to grab the goniometer, and I'm going to measure her foot. Okay. So I'm lining it up with the fibular head and placing the center of it on the lateral malleolus. Okay, I'm going to have you bring your foot up again. Bring your toes towards you. So right now she is at 30 for dorsiflexion. And put your foot down again. And at almost 0 for plantar flexion. So now I'm going to go into passive range of motion, so I'm going to do the motions for her. So first I'm going to do dorsiflexion, and then plantar flexion, and then inversion and eversion. Now I'm going to go into strength testing, which is manual muscle test. So I'm going to add resistance while she does the movements. So bring your toes towards you. So this is for dorsiflexion, and push down for plantar flexion. I'm adding resistance as she does the movements. Point your toes in for inversion, and out for eversion. Okay. Now I'm going to go into testing. So first I'm going to do anterior drawer test. So I'm going to hold here, and I'm going to just pull the foot towards me. And if there was any laxity or increased movement here, I would think a positive test would be that there was an injury to the anterior talofibular ligament. So that test would indicate a tear of that ligament. Next is the talar tilt test. So I'm going to hold here, and I'm going to go in, and that's the inversion one. And then the eversion one is when I go out like this. And a positive test for that would indicate damage to the calcaneofibular ligaments. for inversion, so this would be calcaneofibular ligament, and the eversion would be the deltoid ligaments would be torn if it was a positive test. Next is Kliger's test. So I'm gonna keep her seated like this, and I'm going to put her into dorsiflexion and external rotation like this. And if there was any pain during that, I would assume, or I would think that she has an injury to the syndesmosis up in here. So yes, there would be syndesmosis damage if that was painful, which would be a positive test. So now I'm going to go into special testing. And I'm going to start with Potts compression test. So I'm going to push on the sides of her leg. And if she had pain, when I was pushing up here or anywhere down the shaft, it could be a fracture. But if she had pain when I was just pushing up here, it could be a syndesmosis sprain. So the next test is the bump test. So I'm gonna bring her foot up and just hit here, and that tests for a fracture. If there was any pain during that, I would send her to get an x-ray because that could mean that she has a fracture. Next I'm gonna do Thompson's test. So I'm gonna take the phone and have you roll over.
Is that good?
Yeah. So I'm going to squeeze here. I'll do it this way. And if I'm gonna squeeze her gastroc, and if her foot does not plantar flex as I squeeze the muscle, it means that she could have an Achilles tendon rupture. Okay, flip back over. So that was Thompson's test. Now I'm going to do Homan's test. So I'm going to have your feet off the end of the examining table. I'm going to hold here and put your foot into dorsiflexion. And if you have any pain back here in your calf, or if it's warm, I would say that it is deep vein thrombosis. So that's what that is testing for. Now I'm gonna do, first let me do pulses. So I'm gonna find the pulses. So this is the dorsal pedis pulse, which is here. And the posterior tibial pulse is just back here behind the the medial malleolus. Here. Okay. So now I'm going to do dermatome testing. So close your eyes. So this is sharp and this is hard and soft. Tell me, when I touch you, tell me which one it is.
Hard. Soft.
So that was L4. Now I'm doing L5.
Hard. Oh, that one's hard. Soft.
Okay. Now I'm doing S1.
Hard. Soft.
Okay. Now I'm doing S2.
Soft. Hard.
Okay. Now I'm going to go into reflexes. So scoot towards the edge of the table. I'm going to do your knee first. Okay. So for that, I'm testing her quads reflexes. And so now I'm going to have you flip over and I'm going to do your Achilles. Oh yeah, keep your foot relaxed. So for that, I'm testing the reflex of the Achilles. And when I hit it, her foot should plantar flex to show that her reflexes are normal, which it is. Okay, that's it.